Good morning and welcome to Ethics and Accountability in Forensic Mental Health. Week 8, this week's topic is boundary violations. This lecture will be viewed by students across Australia, and therefore I would like to acknowledge the traditional owners of all of the lands throughout Australia. I would like to pay my respects to the elders of these lands, the elders who have passed, and the elders still present today. I would like to acknowledge the hardships suffered by these people across Australia and hope that the material within this lecture is sensitive to this. So, an overview of what we will be covering today. We'll talk about the difference between boundary crossings and boundary violations and look quite closely at boundary violations, the harm that they can cause to clients and practitioners as well as the profession or organisation in which they work. We'll look at some of the risk factors for boundary crossings and violations, the ethical issues involved, and how we can go about preventing harm. So boundaries is a little difficult to define, but there are commonly accepted definitions. So Guthiel and Gabbard have distinguished between boundary crossings and boundary violations. In general, a boundary crossing consists of a more benign variation of practice that does not result in harm to the client, whereas a boundary violation is more clearly harmful to or exploitative of the patient. The degree of harm, however, can vary from a missed therapeutic opportunity to misconduct of a sexual nature. So boundaries are considered to be the edge of appropriate professional behaviour. Guthiel and Gabbard suggest that what distinguishes harmful and non-harmful boundary crossings could lie in whether it is discussed or discussable. Glass in 2003 also suggested that boundary crossings that become so profuse, prolonged, unquestioned, and unconnected to any obvious therapeutic intent verge on malpractice. An understanding of ethics and the application of ethics to clinical practice assists the mental health practitioner in being aware of departures from good practice and how such departures can be prevented or addressed. Boundary crossings and violations can occur in a number of areas. So the most publicised is in the area of sexual misconduct. However, serious boundary violations often begin with less serious departures from accepted practice. It is therefore important to have an understanding of the range of areas in which boundaries could be crossed or violated. So these can include across time, place and space, money, gifts and favours, clothing, language, including self-disclosure or the use of coercion and threats, and physical contact. The inappropriateness of boundary crossings and violations has been discussed by Bernstein and Hartzell, 1998, in terms of the objectivity of professional judgment being threatened, normal procedure being bypassed, a risk of being exploited, a risk of harm to the client, and negative consequences for the profession as a whole. So by understanding the ethics involved in boundaries and applying these to practice, assistance for the mental health practitioners in being aware of departures from good practice can occur. So the harm that a client could experience includes psychological, physical, or sexual harm, and they can have wide-ranging consequences, from reactivating or reinforcing long-held feelings of worthlessness or abandonment to self-harm by vulnerable clients when expected needs aren't met. Harm to clients can include relationship disruptions, acute emotional reactions, chronic mental disorder, mistrust of future practitioners, and a more general public mistrust of practitioners. From an ethical perspective, the harm to the client has to do with the breaking of the professional promise. The client can rightfully expect professional treatment by the practitioner, where this means that treatment has equal attention to all other clients and is in accord with professional standards of practice. Boundary violations, including sexual misconduct, are the breaking of that promise and of the trust which underpins the professional relationship between a client and a practitioner. We need to remember the ethical principle of do no harm or non-maleficence. The other thing to consider is harm to the practitioner perpetrating the violation, because in addition to harm for the client, there may be negative consequences for the individual practitioner's reputation and employment. There also may be wider consequences. The reputation of mental health care services generally may be called into question, and this could deter people in need of treatment seeking treatment, or create concern among individuals who are currently in treatment. Public cynicism and a lack of trust also can undermine the establishment of a therapeutic relationship, and therefore treatment effectiveness can also be disrupted. So some of the harms that may occur to the practitioner include the trauma of being investigated, potentially losing registration with their professional body or their employment position, consequences among family members and their social network, losing their reputation, losing the reputation of the profession and or the organisation for which they worked, and financial consequences. So there has been research done on boundary violations. For example, there was an anonymous mail survey in Australia, which found that 7.6% of psychiatrists reported some type of erotic contact with clients. 4% of male psychiatrists reported sexual abuse of clients. 60% of psychiatrists reported that they had been informed by a patient of sexual misconduct by a previous therapist. And 50% said that at least 2 of their patients had described abuse in previous therapeutic relationships. So, sexual exploitation could refer to any sexual relationship, consensual or not, with a client, present or in the past. Sexual harassment is considered to be any sexual behaviour in a trust relationship that is unwelcome and the professional agrees to act in the best interest of the client for a monetary reward. That is the basis of forming a therapeutic relationship. Sexual assault is criminal assault involving application of threat or force of any kind for a sexual purpose. They're just some definitions. So it might be interesting to have a look on the APRA website for information about panel hearing decisions. So this can give you an idea of the types of boundary violations occurring across the different professions, and it can be quite surprising what sort of things do actually happen. So some of the risk factors, some of the more common ones for boundary violations occurring. So the work setting, research has found that the most serious boundary violations occur when practitioners are working in an individual practice, and especially if the office is isolated. So steps that we could take if we do work in isolation, we can establish a clear framework around the location, the duration and scheduling of sessions, and the contact with clients outside of the sessions. Clarify issues around money, such as fees, charges for missed appointments, debt handling and gifts. These could all be stated up front before therapy commences. And regular supervision and support from other peers and professionals is obviously essential in preventing and managing these sorts of things occurring. So small communities also add risks for practitioners. So working in small towns regionally or rurally, or working within ethnic groups where there's a lot of close relationships among the community. This brings up issues of practitioners having to socialise, shop, or engage in community activities potentially with clients, former clients, or the family and friends of clients. So once again, this is a difficult situation which takes a lot of consideration and a lot of engagement in supervision. But what we can do is be ongoingly particularly mindful of confidentiality and ethical issues, be very clear about what steps that you will take as a practitioner, and it may be important to go over and above for the purpose of maintaining perceived confidentiality among the community, so that the people within the community and the clients feel very confident that confidentiality will be upheld by yourself as a practitioner. In informal settings, for example, social settings, there is a greater risk of boundary violations occurring. So any personal or friendship relationship can reduce objectivity and disrupt the professional relationship. So once again, it would be very important to make sure as a practitioner that you have very clear social boundaries. Once again, particularly in small communities, that means you may have to make the decision to not be involved in certain social or informal settings. Financial issues also provide a context in which boundary violations are more likely to occur. So this can occur when consulting within an organisation or across organisations. So once again, be mindful of what all the potential conflicts of interest could be and what the confidentiality issues are, and take steps to manage them and prevent issues occurring. And use common sense like avoiding doing business relationships with current and former clients. Don't borrow money from clients, and don't engage in activities with clients that could potentially involve the exchange of money. Multiple professional relationships also is an area in which the boundary violations are more likely to occur. So these can include different professional services required by the same client when the goals of the services aren't compatible. So, for example, the therapeutic and court reporting relationship, there are different ethical and practice considerations working in treatment settings or providing treatment to a client compared to providing a forensic assessment or report for a client. So, ethically speaking, when providing treatment or therapy, our duty is beneficence. When working for a court, the ethical duty is to discover the truth. So, boundary crossings and violations, as we've said, they can occur in a number of areas, and the most publicised generally is the area of sexual misconduct. However, serious boundary violations usually begin with less serious departures from accepted practice, and that is what it has been termed the slippery slope. So therefore, it is important to have an understanding of the range of areas in which boundaries can be crossed or violated. So when we look more closely at the inappropriateness of boundary crossings and violations, often what we find is that the objectivity of professional judgment has been threatened. A normal procedure, for some reason, is being bypassed. There is some risk of being exploited there by the client, and there is some risk of harm to the client. And as we've talked about, there are broader negative consequences for mental health professionals. So the ethical issues associated with boundary crossings includes the ethics of objectivity. So this is based in justice and equality. So this is a theme that's common to both Kantian and utilitarian ethics, that people are to be respected as equals, and we should not distinguish people on the basis of considerations such as natural ability, upbringing, wealth, or class. Rather, people share a common property that makes them equally valuable. So that is, people are capable of being rational, of feeling pleasure and pain, and people have rights. So objectivity and impartiality in professional judgment is ethically significant because it is a means by which the practitioner shows his or her respect for the other person. And boundary violation is disrespect for others and putting one's own interests ahead of professional responsibility. So a reference where boundary violations can be conceptualized from the various ethical perspectives, including Kantian utilitarian, is Radin, 2001. Following correct procedure is considered to be an essential part of professional integrity, and it's a practice that finds its support in ethics. Abiding by correct procedure is one way in which a practitioner can express respect for all persons. So all clients should be treated equally, and this should occur when practitioners follow due procedures. So bypassing a procedure is to make an exception of someone and as a consequence to introduce inequality among clients. So everyday practitioners do face a variety of situations that entail potential boundary crossings or violations. For example, practitioners may be required to do home visits, to enter into an inpatient's bedroom, or maybe offered gifts from relatives, or it may be sitting down and whilst the client is eating a meal and sharing food. So sometimes boundary crossings may be necessary and actually beneficial to the client. So these areas are grey areas and do require consideration, reflection, and where possible discussion through supervision. And preventing harm to clients and maintaining professional integrity can be addressed at an individual level, a professional level, and a service level. So strategies for preventing harm include the following. Firstly, having a very sound working knowledge and awareness of the ethical and conduct codes. So these might be the professional discipline ethical codes, the ethical codes put in place by the organisation or the service in which we're working, as well as the government ethical codes. Being aware of and sensitive to departures from normal or standard practice is important. Discussing such departures from normal practice with a supervisor or senior clinician, or in other forums that have been put in place by the organisation, such as a team meeting. It may also be appropriate to discuss the behaviour with the client, so that misinterpretations can't occur. And the establishment and maintenance of processes to limit or support practitioners who are working in isolation from their peers, as well as promoting processes for documenting, supervising and reviewing. So this could include forums where strong feelings, including possibly sexual feelings from either a practitioner or a client, could be openly discussed. And establishing processes allowing prompt investigation of complaints, including complaints about ethical behaviour. So, some of the key take-home points from the topic of professional boundaries. Professional boundaries are invisible interpersonal dimensions relating to rights, responsibilities, and respect. It's considered that there is an invisible line between acceptable behaviour and violation of boundaries. And drawing the line is helpful because it clarifies when parties have trespassed, violated, or devalued a trust, contract, or functional relationship. So, how can professional boundaries be established? And this is particularly relevant working in forensic mental health, where many of the clients do have difficulty placing their own boundaries around themselves, and they come to be placed in institutions such as prisons or mental health hospitals, where there are physical boundaries placed around them, which in turn help them to contain their behaviours. There is also a very large power differential in these sorts of environments, which does make the client more vulnerable. So we need to be aware of this, and we need to be aware of where our own professional and personal boundaries are and should be, and these may need to be adjusted in different settings with different types of clients. Being clear and explicit right from the beginning, right from the outset, about what our role is and what the limits of our role may be is very important. This can be done verbally and or in writing. Being clear about what can be expected from the professional relationship, having that discussion at the start, providing the client with questions around the nature of the relationship, and trying to answer them as openly and comprehensively as possible. And being aware that at times it can be difficult to set boundaries. And this is because of human nature and the different types of things that can occur in interactions. So we need to continue to self-monitor to be aware of our professional ethical responsibilities in terms of boundaries. So what we can do is to prioritise our own personal and professional safety and our integrity by ongoing vigilance, by self-reflection, reflecting on practice and examining our behaviours, by debriefing regularly with peers, other professionals that we work with, our colleagues, and also making sure that we discuss these issues with our supervisors. So these are some helpful things to be aware of during our interactions in our professional roles, that it is okay to be friendly with clients. That doesn't mean that we're going to be a friend. There's a big difference there. We can be personable, and that doesn't mean we have to be personal in terms of disclosure and things like that. Of course, we will be supportive in our helping role. That doesn't mean that we have to be an advocate for the client, as that may be stepping over a boundary. We, of course, will take an interest in the client. That is an important part of therapy, for example. But being interested in their concerns and their issues does not mean being familiar. Being empathic is trying to understand the client from their point of view, understand their perspective and their feelings, whereas being sympathetic is feeling sorry for the patient, for the client. Acting confidentially is protecting the client's personal information and what occurs during the professional relationship, and that is different from being secretive. Being persuasive, so obviously, especially in a therapeutic role, we may need to be quite persuasive in terms of motivating clients to learn new behaviours or practice new skills, whereas being manipulative suggests that we are trying to get our own needs met in some way. And lastly, being consistent. So consistent in our dealings with one individual client and consistent across clients rather than being pedantic. So some other basic rules for practice include don't touch, as we've talked about. Don't make special arrangements for any one client that we wouldn't do for others. And don't make personal revelations that aren't actually relevant to helping the client in their therapeutic goals. Don't dwell unnecessarily on sexual matters. And if you feel uneasy, consult your colleagues. So a quick guide for checking is it ethical could include asking yourself the following questions. How do you think others would perceive what it is that you're saying or doing with your client? If you were challenged, how would you explain your behaviour based on the principles of ethical practice? If you feel an inner squirm or you have that gut feeling and you think that your behaviour would be hard to explain, then that may be an indication that you need to stop, seek consultation and reassess what it is that you're aiming to achieve. So good decisions should be not only effective, but ethical. Some little rules of thumb, which I would suggest you could come back to time and again. So, the scenario for the third of the 4 Mark discussion board posts is about boundary violations. So, for practice, this scenario includes a boundary crossing. So I'll read the scenario and you can have a think about what you might do, what some of the ethical issues are in this situation, and I will briefly outline some of my thoughts. So the scenario is that you see a parent group advertised in your local paper. It is only a few streets away from your house, and it would be great for your children to spend some time with other children while you chat to the other parents, relax and socialise. You turn up for the first Saturday, introduce yourself, talk about what you do for work, and decide that both you and your children really enjoyed it and got a lot out of it. You turn up on the next Saturday, and while talking to one of the other parents, you notice an ex-client come in with her children. You don't acknowledge the client as you don't want to breach confidentiality in any way or make your ex-client feel uncomfortable. It is a large parent group, so you don't think this will be a problem. But later on, the ex-client pulls you aside and asks you to not come anymore, as she doesn't want anyone to know about her history and she doesn't want to be reminded of it. And she tells you how this is causing her distress. So, as I've mentioned, this scenario represents a crossing rather than a violation of boundaries. And clearly, in this situation, there was no intention on behalf of the therapist to do any harm. But unintentionally, by going about their business, trying to socialise, the therapist has caused some distress to a previous client. So as we know, for anyone involved in treating clients, there is a power differential, and after the therapeutic relationship ends, that power differential remains because you have been privy to personal information some of which would be very sensitive about the client, and it is your ongoing obligation to protect that information. So some professional bodies, such as the Australian Psychological Society, may accept that it is permissible with conditions to enter into a personal relationship with a client after a period of time, for example, 2 years. However, there are other factors to consider. So the ethical principle of non-maleficence, doing no harm, you would want to prevent further harm to your client by socialising in that group, as it has already triggered some distress, and ongoing socialising would likely trigger further distress for her, and now you're aware of that. Whilst as the therapist, the ex-therapist, you may have no intentions of disclosing any knowledge of the client or disclosing any information about the client in a social setting. When you are not in your professional role, there is a greater risk of inadvertent disclosure of knowledge. So there are some potential issues to consider there. The other issues to consider is potential harm to yourself as a professional. So as we know, it is important to maintain a work-life balance in order to function well and to be able to practice well as a professional. So it's important to be able to go out and socialise without professional obligations. However, in this situation, you do have an ongoing professional obligation. There is the ongoing power differential, and you would have to remain mindful of protecting information. So there's just some things to consider. So have a think about it and jot down some of your own thoughts about the ethical issues and what you might want to do. So some of the readings for this week's lecture include these ones that are listed here. And some other resources that you might find useful to refer to include these ones. So thank you for listening to today's lecture. And if you've got any questions, please don't hesitate to email us. Thank you.